Hi all. In this video, we are going to discuss about transabdominal sonography procedure, which is done under ultrasonography and Doppler studies. So, ultrasonography, which uses a high frequency sound waves to create real-time images of internal organs, such as internal organs including vessels and tissues for diagnostic and monitoring. So, Doppler studies, which also assess blood flow, vascular integrity, and it detects abnormalities by measuring the reflection of sound waves from moving blood. Transabdominal sonography. It is a common invasive methodology to visualize the pelvic and abdominal regions. So this is how an abdominal ultrasound will look like. And the right side picture shows of the Doppler ultrasound of abdomen. And the techniques are nothing but high frequency probes will be used to convert electrical signals into sound waves. So gel will be applicable, which removes the air between the probe and skin to ensure optimal acoustic contact. So Doppler techniques, which also includes three types of Doppler. First thing is color Doppler, which maps blood flow visually. Second thing is spectral Doppler, which graphs velocity of blood flow. And the third one is power Doppler, which is sensitive for detecting low velocity flow. So now a selection of sonography for transabdominal region is it is chosen based on the clinical indications, such as when the patient comes with abdominal pain or with some vascular issues, or for an organ screening, like to screen a liver, or to screen a spleen, or to screen a gallbladder. It has been used, and for obstetric applications also. Transabdominal ultrasonography is used. Doppler modality selection, which is guided by suspected pathology, like if the patient is having any stenosis or tumors, or if any clot is present. So in these type of indications, a Doppler modality will be selected. So patient preparation instructions and patient position are as follows. So general preparations is nothing but, first thing we have to ask the patient to be in a fasting for about 6 to 8 hours. It is useful for a clear imaging of the bowel region. Why? Because if the patient is in fasting, it reduces the bowel gas productions. And next thing is hydration. Patient may be instructed to drink water for pelvic scans to fill the bladder. If the bladder gets filled, and if once the patient drinks plenty of water, the bladder will get expanded, and we can easily visualize the abnormalities of the bladder also. And clothing, loose clothing is recommended. Patient may be asked to wear a hospital gown. No lotions, oils, or powders on skin is been applicable before the scan. Positioning of the patient for transabdominal is nothing but the patient lies supine on their back. Either a pillow or cushions may be given if the patient feels uncomfort. For vascular studies, it may use semi-flowers or side-lying positions if the patient is if it is needed. Patient instruction is nothing but the patient has to remain still. Breathing instructions will be given by the physician or by the radiologist to avoid the motion artifacts. And patient care and maintenance protocol is nothing but we have to inform the patient about the procedure, and we have to address all the concerns. And next thing is we have to monitor if the patient is having any discomfort, or if the patient feels any anxiety. Next thing is hygiene protocol should be maintained for probes, for ultrasound gel, to prevent any cross infections to the patient. A regular calibration and maintenance of the ultrasound equipment should be done before each and every procedure to check the quality assurance of the equipment. And clinical applications is nothing but abdominal scan visualizes uterus, ovaries, bladder, which diagnoses the cyst, tumor, pregnancy, and fluid collections along the regions of the visualization. And Doppler thing, we have in Doppler ultrasound we can evaluate arteries or venous patency, organ perfusion, fetal well-being, and vascular anomalies. So widespread, it is used for obstetrics and gynecology, hepatobiliary regions, and for renal investigations, and also for vascular medicine also. Display methods and image quality, it gives real-time imaging, and the image optimization will be image will get optimized to gain better results. Quality assurance will be checked before enhancing the reproducibility and reliability. We have to ensure that high quality images are produced to reduce the diagnostic errors. So after completing the procedure, or else before doing the procedure, we have to give an assurance to the patient for doing the procedure that it is a non-invasive procedure, no radiation will be given to the patient, and it is safe for all ages, even for pregnant ladies also. So well tolerated with proper explanation and preparation should be given. Immediate feedback and results should be given to the patient quickly. Thank you.